and welcome to India Top Doctor. Today we will talk about regenerative therapy for chronic pain. Do you know what is it? No? No worries. We have Dr. Sudhir Dara with us who will be telling us about it. Dr. Sudhir Dara is an internationally renowned pain physician who holds the India Book of Records for doing maximum number of PRP therapy for chronic musculoskeletal pain. Apart from being a medical professional, academician, public influencer, and philanthropist, he has been a pioneering figure in fostering the growth of a specialized pain medicine branch as a niche specialty in India. So let's welcome him. Okay, so welcome to India Top Doctor. As you know, today we will be talking about regenerative therapy. But before we move ahead, can you tell us what is regenerative therapy?
Yeah, good morning. This is Dr. Sudhir Dara, founder of Ipion Center for Pain Relief, Hyderabad. We deal with regenerative therapy. Regenerative therapy is nothing but you regenerate or regrow the damaged tissue in the body. For example, the joint cartilage, the muscles, the tendons, when they get deranged or when they get injured or when they get degenerated because of the old age, we regenerate or make them corrected and come back to its original structure by using the patient's own blood. Patient's own blood has got a growth factors. We extract those growth factors and inject with a small needle into the place where that particular structure has gone wrong, so that that structure will come back to complete normal state and the patient can be completely mobile and come back to his original state. So this is known as regenerative therapy.
All right, sir. So are there any challenges to regenerative medicine?
So a lot of challenges are there as it is being a new therapy. It's a new innovation in allopathic medicine. So basically, this is done for all the musculoskeletal degenerative and injury conditions. Like you get a injury in the shoulder, you get an injury in the knee joint, or your shoulder degenerates with old age, degenerates with obesity. So right now the treatment modalities available are initially the doctors prescribe painkillers and afterwards they do a physiotherapy, then finally they do surgery. So basically any surgical intervention on any particular part of the body can be a problematic, like it can lead to some complications and side effects. So the new concept is why don't you regenerate that particular structure without cutting the skin of the body? So inject these blood cells which have got growth factors and you kind of remodel them, you kind of heal them. So the challenge here is the belief whether this small injection or whether this the growth factor therapy is going to completely restructure or regrow or repair that part is the basic belief the doctors they don't have. So in Ipion, what we have done is we have done almost like 10 years of research on this particular regenerative therapy, and we have done thousands of degenerative conditions or sports injuries or road traffic accidents where surgery was warranted, and we have done this regenerative therapy and completely cured that particular condition without any surgery, because as you all know surgery has has got a lot of complications. So the challenge here is to make the physicians, to make the doctors believe in this, and to make the patients also believe that something is getting relieved or something has got only surgical module as the option. Now someone is saying just a needle procedure, can it give a proper relief? But in Ipion, we have done more than 50,000 cases in different structures, where most of them, more than 90% of the success was there with simple injection procedure. So the challenge is this one, and slowly the whole of the nation and the whole of the world is completely changing its scenario from surgical to non-surgical therapy with this module of regenerative therapy.
All right, sir. And as you said that it is newly introduced, do you think it has a great potential in the coming years?
Yeah, it has great potential, and it has shown also over the period of 5 years. No, lots of doctors have are opting for this regenerative therapy because every condition is not cannot be cured by surgery. Surgery is it's got a lot of side effects, complications. Not in all the patients, but if not side effects, no, the morbidity. Once you cut the tissue, any tissue, no, in the initial phase, it might give a very good relief, but in a long run, there will be lots of changes happening in that particular structure. So the potential is no to giving comfort to the patient, making the patient believe that no, it's a natural therapy. So basically, you are using your own blood to heal your body structure, and the results are very good. That's why it has got a huge potential in Ipion. Today we do around 500 to 600 interventions, 500 to 600 conditions we treat every month. So we have opened a center in Chennai also. We are opening lots of centers all over the India and abroad also. So it has got a great potential, and the major advantage is cost effectiveness. So there is no hospital stay. It's a small injection. It's a daycare procedure. It's got an immediate relief. No sequelae or complications in the post procedure, and the acceptability from the patients will be very high when compared with the surgery.
All right. And how effective can be regenerative medicine, if you can talk about that?
So regenerative therapy, as I told you, since 10 years we've been doing this. So we have done a study, case series study, the effectiveness of this one. We would say if you take the knee joint arthritis, where the knee joint arthritis, everyone thinks that now the only option is knee replacement surgery. So in those cases, those people who have got suggestion to undergo knee replacement surgery, and they have come back to us, and we have treated them more than 10,000 members, more than 10,000 knee joint treatments you have done. And the efficacy you're asking, we can say that in our study it's almost like 85%. So per 100 patients, 85 people, 85 patients who have got severe knee osteoarthritis, they got a complete relief, and they are still in our follow-up. Now and then they come and they show, and we keep the patient in follow-up. So the effectiveness, if you talk in terms of percentages, at around 80 to 85%, which is almost equal to the surgical maneuver, where in surgical maneuver there are complications. The beauty of regenerative therapy is there are no any complications, no side effects. You can say zero complication and zero side effects with the effectiveness of 80 to 85%.
All right. Sir, you hold the record of doing maximum number of PRP therapy. Do you, can you tell us that is it added to the stem cells also?
No. See, the problem here is stem cells in India are not legalized. Okay, PRP is completely different from stem cells. Stem cells are those cells, the mesenchymal cells. We take it from iliac bone. So these permissions are there in other countries. In India, stem cells are indicated only in patients who are having cancers, only for the cancer treatment. So musculoskeletal disorders, stem cells are not approved. If you can go through ICMR guidelines, stem cells are not there for the musculoskeletal condition. So PRP is purely a PRP. It is known as platelet-rich plasma therapy, where the growth factors will be there. A more furnished kind of treatment is from PRP, we extract the growth factors, which are the key components of the regenerative therapy, and we inject them. So stem cells, PRPs cannot be mixed, and stem cells are not legalized in India.
And sir, what can patients expect after the whole procedure?
So what patient expect is not the issue. What patient needs and what patient's requirement is more important in any patient. So patient comes to us with a shoulder pain. A sports person comes to us with a sports injury. What he wants is he wants to get back to the court as early as possible. So what you need to tell him is the reality. So what is happening in his particular shoulder, what are all the conditions, what are all the damages happen, and how we need to correct the damage with regenerative therapy, and how what we are going to do, patient should be knowing, and what he has to do, okay, in the follow up and in the form of rehabilitation. So what patient expects is what the doctor says. What the doctor says, he should listen, and he has to come back to his normalcy. Whether a sports person wants to come back to the sport, or some software employee comes back to his routine work of sitting for 12 hours. That should be kept in mind, and the expectations and the reality should come into a line. So his expectations should not be too high, okay, and our reality should be not low. Both should be coming together, so that the proper effect will come. So you have to be very truthful to the patient. You have to be very realistic to the patient. But whatever said and done, whatever the patient expects, the doctor has to fulfill that. But for that, everyone should get involved. That means the proper counseling should be there, proper counseling of the patient, and also proper counseling of the relatives, caretakers, and you have to be very truthful to the patient. So the expectations can be met only with when we all sit together and you discuss and solve the problem.
Thank you so much, sir, for taking out time and sharing such valuable information with us. One last question would be, any message you would like to give to our audience?
So to all of the audience, I tell, whenever you get any pain in any part of your body, if it is for more than 10 days, evaluate that structure. Don't go for painkillers. Don't go for unnecessary physiotherapy. So if you have pain in the knee joint, it is lasting more than 10 days or 15 days, evaluate what is that structure that is gone wrong. What is that structure which is causing you the pain? So the early you diagnose it, the early will be the regenerative therapy successful. If you make it chronic, if you neglect it, if you start doing physiotherapy not knowing the pathology inside, so what will happen is it will become very chronic, it will become very stubborn, then you have to go for a major surgery. So start early, diagnose the pain, identify the pain, go to proper doctor, get evaluated. But if surgery is not at all warranted in the initial stages or late stages, try to think about regenerative therapy. Regenerative therapy is the simple and safest method. If properly done, you will never need any surgery. So be aware of your pain, any chronic pain anywhere in the body. If it is more than 10 or 15 days bothering you, you have to go and get this done of what is that happening inside. Some test, so that now you kind of know it, and properly, if you get the awareness of this regenerative therapy, you can avoid the major surgeries, major catastrophes, and major side effects in our life.
Thank you so much, sir.
Thank you. Thanks a lot.
And if you want to book an appointment of Dr. Sudhir Dara, you can do the same by visiting India Top Doctor. And for more such videos, like, share, and subscribe to our channel. Thank you.